The health practitioner regulator has announced new guidelines for dentists and nurses who do non-surgical cosmetic procedures like anti-wrinkle injections and fillers. The agency has concerns some practitioners are putting profits ahead of patient safety as the multi-billion-dollar industry continues to expand. National Health reporter Elise Worthington is with me in the studio with more. Hi there, Elise. So what changes are being brought in and do they apply to doctors?
So we already have guidelines in place for doctors who are working in this industry. So these new announcements bring nurses and dentists who can also do cosmetic injectable type work into line with doctors. So a lot of practices are actually run by nurses who do the injecting. And what has happened is that the regulators around the country, both state and federal, have been looking at this practice a little bit more closely and seeing that some nurse practitioners are using telehealth consultations where doctors then prescribe these products that they inject, like Botox or fillers, and that there's a bit of concern over whether or not there is appropriate oversight of that process and who's responsible. So if a doctor sees someone over telehealth briefly, then the nurse injects, who has that ongoing care. So these guidelines are designed to make it clearer that it is the person who prescribes the medication as well as the nurse who needs to have additional training now under these rules in order to do those kinds of injectable procedures.
And this is all part of a broader crackdown by state and federal authorities.
Yeah, so as I said, they've been looking at this model of nurse-run clinics, especially in New South Wales and Queensland. Part of it is that if you go in for a consultation, it's much simpler if the nurse has in the clinic the kinds of products that will be injected into your face or wherever prior to the appointment. But because many of them aren't authorised to prescribe medication, they're not actually allowed to hold it on consignment for then that doctor to do that telehealth consultation. So that's where regulators have been saying, look, this isn't complying with the current regulations, and these guidelines are designed to make it much clearer that there needs to be greater oversight and more training before nurses can expand into this space.
And what new guidelines are there for advertising, Elise?
So obviously a lot of these clinics use social media prolifically to advertise their services to potential patients. Now there are bans on using social media or any advertising of prescription medications or procedures, which a lot of these are. So under these new guidelines, they won't be able to use testimonials from social media influencers, and they also can't target advertising towards people under 18. So already there are rules in place to prevent this. The TGA has been sending out guidance letters to clinics around the country over the past few months. They say they send out about 100 letters just reminding people of their obligations, but this is part of sort of a broader crackdown to ensure that patients aren't being sort of incorrectly influenced into getting these kinds of procedures done, and when they do, they're seeing appropriately qualified practitioners who are able to keep them safe.
Right, and how long do practitioners have to comply?
So there's a grace period, I guess, of a few months until September. So clinics around the country will be sort of looking at their processes and procedures and working out what they need to do to make sure that they're up to standard. And the regulator, AHPRA, says they will be knocking on doors after that to ensure that all the rules are being followed.
Thanks, Elise.
Thank you.